So, hello, good afternoon, everyone. I am Carmen Joy Horonka, a first-year college taking a Bachelor of Science in Nursing. So now I'm going to perform the head, eyes, ears, nose, neck, and throat assessment. Hello, sir. I am Carmelin Joy Horonka, your nursing student for today. So, are you Marky Abadis?
Yes.
Okay, so, hello Marky. So today we're doing a assessment of head, eyes, ears, nose, neck, and throat assessment. So, shall we start?
Yes.
So, sir, I'm gonna start in inspecting your hair and head. So, can I touch your hair?
Yes.
Yes. Okay. So okay. There are no dandruff or lice, lesions, or any scars in your head. So, the head size seems to be normal. Yes. So, sir, I'm gonna palpate your head. So, can I touch it again?
Yes.
Okay. So, tell me, sir, if you feel anything. So, do you feel any pain?
No.
Okay. So, no. Do you feel any pain?
No.
So, sir, uh, the head size is normal, the hair is normal, and it's smooth to touch, and there's no dandruff, lice, or lesions. Now, sir, we're gonna proceed to assessing your face. Okay, so the palpebral feature seems to be symmetrical and normal. So, can you show a smile for me, sir? Okay. So, the presence of a nasolabial folds are present and symmetrical of both left and right. So, sir, I'm gonna proceed to inspecting your eyebrows. So, it seems to be symmetrical on the left and the right side. So, can I touch it?
Yes.
Okay. So, the the distribution of hair seems to be even and normal on the left side and the right side. Okay. So, the patient eyelashes are evenly distributed, both left and the right side, and they are both symmetrical. So, sir, can I touch your face?
Yes.
Yes. So, the eyelids are both symmetrical, the left and the right side. Sir, could you close your eyes
Yes.
and tightly then open them up? Okay. So, patient has no trouble to opening and closing the eye. Yes. So, the eyelids are covering the part of the sclera, which is normal. So now we continue to assess the patient's palpebral conjunctivae. So, could you look down for me, sir? Okay. So, I'm gonna pull your lashes a bit, okay? Okay. Okay, so remember to wear gloves when doing this procedure. So, you blink for me? No. Okay. So, the other side. So, okay. You blink for me?
No.
No. So, okay. Do you feel anything? Or do you feel any pain?
No.
Okay, so there's no swelling, no presence of foreign bodies, or foreign objects rather, or any pain felt by the patient. As I did check the palpebral conjunctivitis. So now I'm going to proceed to palpating the lacrimal glands of a patient. So can I cut? So now I'm gonna proceed to palpating the lacrimal glands of a patient. So, sir, can I touch your face?
Yes.
Okay. So, there's no seem to be swelling. Everything is normal with the lacrimal gland. So, I'm gonna proceed to nasolacrimal glands. Can I touch your face, sir?
Yes.
Okay. So, do you feel any pain? No. Okay. So, the patient feels no pain. And there's no presence of a swelling. So, now I'm gonna proceed to assessing the conjunctivae of the patient. So, can I touch your face again, sir? Okay. So, could you please look up? Okay, look up. Okay, very good. So, the patient conjunctivae is pinkish color. There seems to be no foreign bodies or any type of swelling or infection. So, the patient conjunctivae is normal, good and normal. So now for the sclera and cornea. So the patient's sclera looks perfectly normal, both the left and the right. Yes, and there are no abnormalities with the patient's cornea, both left and right side. So the sclera and the cornea is normal. So we're gonna proceed to the iris of the patient. So, the patient's iris is dark brown, both left and right. Yes, and then they are same size. So, the normal iris, it should be 10.2 millimeter to 13 millimeter. So now we're going to proceed the constriction of the pupil of the patient. So, so by the way, I dim the light. Yes. Wait. Okay. So I dim the light.
Yes.
So sir, I'm gonna check your eyes again. Is that okay? Yes. Okay. So, okay, sir, I want you to look that object at the moment. Yes. Because I'm gonna check your eyes. Okay. So both left and right of the pupil of the patient is normal. So now, sir, I want you to look at my fingers. So just focus on the fingers, okay? Then I will light your eyes, okay? Focus on my fingers.
Yes.
Okay. Okay. Okay, so so both pupils, left and right, are still constricting and reactive to the light, and it's normal, and it has a accommodation and is responsive to light. So, sir, what I'm gonna do now is I'm gonna show fingers on the side, and while you're on the side of your eye is covered, so you're just going to tell me how many fingers you see, okay?
Yes.
So, okay. How many is this?
1, 2,
Okay.
3,
Okay. How about now?
2,
Okay, so on the other side, sir. Okay. Now the other side of your eye. Okay, so how many is this?
1, 2, 3, 2.
So the patient can identify how many fingers there are. So now we're going to proceed in assessing the patient's ear. So I'm just going to see if his ear is level to his eye. So the patient's ear is almost level at the patient's eye. So now we're going to palpate the patient's cartilage and the mastoid process. So, can I touch your face again, sir?
Yes.
Okay, so. Do you feel any pain?
No.
So, there seems to be no swelling with the cartilage. So, okay, now to mastoid process. Do you feel any pain?
No.
Any tenderness?
No.
So, there are no swelling and no masses. So, the cartilage and the mastoid process is normal. So we're gonna proceed in assessing the ear canal and the tympanic membrane of the patient. So, can I touch your ear, sir?
Yes.
Okay. Do you feel any pain if I pull this ear of your ear?
No.
So, okay. So, the patient canal is same with color of the ear, and there are no presence of the foreign objects, and there are cerumen of wax, which is totally normal for the patient. So now we're going to proceed in the other side. Do you feel any pain, sir?
No.
So, the ear canal and the ear canal of the patient is normal. So, we're gonna proceed in the patient nose. So, the patient nose is in the middle of his face or midline. So, both nostril are there seems no deviation, and the septum is normal. Both nostril are normal. Now, sir, we're going to occlude it one-sided of your nostril. So, do it like this. Can you do it like this, sir? No, this one. Okay. Inhale, exhale. So, do you hard time breathing? No. Okay, the other side, sir. Do you hard time breathing? So, the patient can breathe perfectly normal even if one side is occluded. So, there is no obstruction in the nose. So, we're gonna check the external nostril of the patient or nares. Do you feel any pain, sir?
Yes.
No eyes?
No.
But so we're gonna check the external nostril of the patient. Do you feel any pain, sir?
No.
Okay. So we're just gonna check the internal nostril of the patient. So sir, I'm just gonna place my hand on your forehead and tilt it back a bit, okay?
Yes.
Okay, so. So, the patient Nasal mucosa is pinkish in color. There are no swelling, no foreign bodies. There are no presence of exudate. There is no septum perforation. So now we're going to check the patient cyanosis, the maxillary, and then the frontal. So can I touch your face again, sir?
Yes.
Okay. Do you feel any pain?
No.
Okay. There seems no swelling. So we're going to proceed in frontal. Can I touch your face again, sir?
Yes.
Do you feel pain?
No.
So, okay, the maxillary in the frontal, there is no swelling and there is no pain as side of a patient. So now we're going to proceed in assessing the patient lips and mouth. So, can I touch your face again, sir?
Yes.
Okay.
Bum, bum, bum.
The patient's lips are both symmetrical, left and right, so there is no lesions, no edema, no bleeding, and there is no problem with his lips. So can I touch your lips again, sir?
Yes.
Okay. So wear your mask as you do this. So the patient's lips are soft and smooth. So now we're going to proceed in checking the patient's teeth. So can you just smile for me, sir? Okay. Could you open your mouth for me? Okay. So as I can see, he has a 28 teeth, which is normal as a 9-year-old boy like him. So, and the dominant color of the teeth is white, and there is no malocclusion. So, sir, could you please stick out your tongue? Okay. Can I touch it?
Yes.
Okay. Do you feel any pain?
No.
Okay, so there seems no swelling, no pain, and no presence of exudate, and his tongue is in the midline. Yes, it is not deviating to the left and the right side. So now we're going to proceed in checking the patient's uvula. Along with it, of course, it is a soft palate. So sir, could you say ah for me, like very long? Ah. So, uh, so, so the patient's uvula is vibrating or moving as he says like very long, so which is totally normal, and it is pinkish in color. The tonsils are perfectly normal. It is around 2.5 centimeters. There is no swelling also on the uvula and the tonsils. So now we're going to proceed in assessing the patient's neck. So, sir, I want you to bend your head to your shoulder, both left and right. Yes. Yes. Do you feel any pain?
No.
So, the patient could do it effortlessly with no pain. So, sir, I want you to bend forward and backward. Yes. Okay, thank you. Do you feel any pain?
No.
So the patient felt no pain. No. So the patient's neck is movable and there is no problem. So okay. So the patient's trachea is in the midline position, not deviating to the left and right. Right. There's no visible jugular vein distension. There's also no presence of thyroid lumps, and patient neck is normal for inspection. So there seems to be no swelling of the lymph nodes, and the patient did not complain of any tenderness and pain. So now I'm gonna proceed in palpating the thyroid, and I'm gonna do in the anterior approach. So, sir, can I touch your neck, sir? Do you feel any pain?
No.
Okay. So the patient feels no pain. So now we're going to proceed in palpating the thyroid, the enlargement. If he has a enlargement of the thyroid. So, uh, I want you to tilt your head over, sir. I, on the other side, sir. Okay, thank you. So, do you feel any pain, sir? Okay, so the patient, so the patient feels no pain, and there is no enlargement of the thyroid, and the thyroid is smooth and palpable and non-tender. So now we're going to assess the patient lymph nodes. So, can I touch your face again, sir? Okay, so I'm gonna use my pads of my fingers to assess the lymph nodes. So tell me if you feel any pain, sir, as I touch it, okay? Do you feel any pain?
No.
Do you feel any pain?
No.
So now we're going to proceed in assessing if the patient has a neck distension. So, sir, could you please tilt your head on the other side? Could you, okay. So as you can see, in the right side has no neck distension. So the other side, sir. The other side also has no neck distension. So, sir, after assessing your head, eyes, ears, nose, neck, and throat, all findings are normal and no complaint of any tenderness or abnormality. So, thank you for your cooperation and God bless. So, thank you.